From the pandemic to racial inequity and treatment, the Biden administration has said improving health care is a priority. Here to discuss it is Dr. Bernard Ashby. He's a cardiologist and Florida State lead for the Committee to Protect Medicare. Welcome back to the show, Dr. Ashby. Always great to have you on. Good to see you.
Thanks for having me. But before you ask the questions, I'm gonna need you to stop with the cap because you know you had an S curl back in the day. So don't even front.
He sure did. He sure did, Dr. Ashby.
Definitely had the S curl back in the day.
Out.
I have never had any kind of curl, activator, S curl, anything. I used to have the sporting waves. Now I used to have the waves running around. Yeah, the wave cap. Yeah, I'll admit that, but nah, I ain't never had a jerry curl.
I'm gonna let you slide on here.
They said I had good hair. Slide. Well, you know what? We're gonna let Joe Biden slide when it comes to the pandemic because he came in and made this as one of his biggest priorities, the response, and he shattered those priorities. Is there anything that he could have done differently when it comes to the pandemic response and COVID-19 relief?
Are you referring to African Americans or in general?
African Americans, yeah, especially African Americans.
I mean, listen, we as a bloc, a voting bloc, are the reason why Joe Biden got elected. And the fact that he hasn't given us anything explicitly that would improve our lot, particularly as it pertains to healthcare, is to me ridiculous. And so, you know, if we're referencing Trump, yes, day and night, and I appreciate that, but that's a pretty low bar to cross. But as it stands, Black folks in particular are still at the bottom of the food chain when it comes to all the racial and socioeconomic inequities that exist in the United States. And so, you know, we are looking for Biden to step up and put his money where his mouth is.
Oh, absolutely. There are many things that we can do when it comes to racial inequities, when it comes to overall health care. I'm specifically talking about COVID-19 relief, though, in this instance, in the first 100 days. What do you think about the job that he's done so far when it comes to that in the Black community?
Yeah, so again, I got to tease it out. Black folks versus the entire population. Yes, he's done an exceptional job, but the reference compared to the previous president and the bar was pretty low. And so everything that he's done is frankly what I expected, and I appreciate that. And he hasn't really dropped the ball on any particular aspect of the pandemic relief. The distribution has gone relatively well, and compared to other countries around the world, U.S. is far and above other countries. I mean, we've been lagging in the infection rate, the hospitalization rate, the death rate, and so based on every metric, we were at the bottom of the industrialized world. And now that we have the vaccines that are available, he came into a mess, and his administration has done a good job of turning that ship around and getting the vaccine into arms of folks and addressing the vaccine hesitancy issues amongst our population.
And so I do hear you because, you know, if we're bearing the brunt of it from the economic impact to, of course, we're dying more, all of these things, and less of us are becoming vaccinated as Black and brown people. What about the messaging? You know, you have his director of the CDC. They seem to fumble the storytelling, the messaging when a Johnson & Johnson has to be paused. And now a bunch of people are saying, that's it. This is exactly what we thought. We're not doing it. So, yeah, maybe he was greater on the curve on the other stuff because it was such a mess. But are you okay with the messaging so far?
All right, Sharon. Well, y'all have me on here, so I'm going to keep it a buck. I mean, when it comes to the messaging, they've done a poor job. I mean, let's just be honest about it. So with the J&J vaccine pause, I came on here and said that was an overreaction. We like to talk about the politicization on the right, but it goes both ways in a lot of circumstances. And the reason why they stopped the J&J vaccine was due to the political implications. If we were just looking at it from a purely empiric, scientific perspective, the rate of thrombosis, particularly CVST, which is the condition where you have the thrombosis in the venous system of the brain, it's so low. And it was really in a subsegment of the population. Women in their 30s had the highest rates. And again, it was so low. And I gave this on a previous interview where you're more likely to die from taking Tylenol or ibuprofen than a J&J vaccine. So based on the fact that they reacted so aggressively and reported the findings, if you were a lay person, I would be scared too to take the J&J vaccine.
Yeah.
But knowing what I know as a scientist and a medical professional and a public health professional, I'm completely not concerned when it comes to the J&J vaccine. Even women in their 30s, if they have access to the vaccine, I tell them to get it. I think the messaging should have been tailored to medical professionals to recognize this syndrome, which is thrombocytopenia syndrome, to treat it appropriately. Because if those patients come in with a clot and you give them heparin, you could potentially exacerbate the condition. And again, it's so low. I mean, it's ridiculous. And you're 10 times more likely to develop a clot with the actual virus. So context is key, and they didn't do a particularly good job at the messaging.
Yeah, well, supply is about to outweigh the demand pretty soon. So go ahead, Sharon.
Yeah.
No, I was just going to follow up. You're the doctor here. I was watching one of the press conferences from the CDC director, Walensky, and she mentioned that drug, heparin, about not administering it in this case only. And I wonder if when we have you back again, you can check on that for us, because that confused me. You know, we've heard of that medication. You just talked about it. But is that advisable in these very rare, I think it's under 1 in a million chance of this blood clot happening. But, maybe you can research, not to turn you into our researcher, but you are the doctor, Ashby.
Well, I would address it right now, but it's very similar to a condition called a HIT. Yeah, it's very similar to a condition called heparin-induced thrombocytopenia. So this is a very similar circumstance. It's an immune-mediated thromboembolic condition, and if you give heparin, it will exacerbate the situation. So if you see someone that has a clot and has received the vaccine or has gotten the virus, you have to look at their platelet count. That would give you some kind of hint that they have this immune-mediated process, and you want to avoid heparin in those particular patients.
Okay, you don't need to
before I
do a
let
bit
you
of
go,
research.
we run out of time. The man is a doctor. No
he
cap.
And
he says no cap.
What I like to hear him
I need you as my personal doctor. I love that. I mean, that's real stuff. I need people to tell me, hey, bro, you need to stop eating all that chicken. That's what I need to hear. Before we let you go, though, we started off talking about the racial inequities and the disparity or whatever, and there are initiatives that the administration is putting out there. But what would you like to see done right now? What is the priorities in your opinion? Because you're on the front lines, you see what's happening to our community. Tell us, what do you need to see?
Well, MLK said this probably 50 years ago, that the greatest injustice that we see in the U.S. is in healthcare. I'm paraphrasing here. And the fact that we still, as a people, lag in all of the indicators in healthcare. We're more likely to die from cancer, heart disease, stroke, and just die earlier in general is really a damning testament to how the U.S. has treated us historically and currently. And we like to talk about things like the Tuskegee experiment and Henrietta Lacks, but we don't incorporate enough of how the current structure of the healthcare system disproportionately impacts people of color, indigenous folks, Latino folks. The healthcare system is a for-profit entity, and unlike other nations who have put their population as a priority and socialized healthcare, we have yet to do that. And they use that term socialism as a buzzword to cause Americans to viscerally react to the fact that healthcare is actually a human right, meaning that we socialize the fire department, we socialize the police department, right? But when it comes to healthcare, all of a sudden it becomes an issue, and that's because some very wealthy folks are making a lot of money at the expense of our lives. And what happens when it comes to profits, the people who are marginalized are the ones who get left by the sidelines. And unfortunately, it's disproportionately related to Black and brown folks. And that's something that myself and other healthcare professionals need to speak to, because we're oftentimes complicit in government-related oppression, government-related marginalization. And don't even get me started on the war on drugs, because that right there is something that is completely, destroying the Black communities right now. And so we have all these cases of police running up in houses for somebody selling cocaine, which I don't really get, because we don't run up in houses for people selling cigarettes or alcohol unless you're Eric Garner, getting choked out. But the point is that we need to rethink how we police this nation, but also how we practice healthcare. And I think people miss the link between the two entities, because it's all part of one common thread. And anybody that knows the history, can open up a history book, can understand that. And we just need to keep it real. And so if we have that honesty now, we can then fix the problems instead of tap dancing around the actual issues.